Good afternoon again, and welcome to our ShuraTV health program. My name is Dr. Azar here with Genesis Medical Center. I'm glad to have you guys here watching. Today is the Tuesday after July 4th, and today is July 6th. Welcome to all our viewers. Hopefully, you're having a good summer. Everything's going well for you. We were discussing a couple of times last week things that are happening in the summer, most likely, with the picnics and outings, and there's less restrictions now because of COVID. So a lot of people are going out and enjoying themselves outdoors, having more activities, and it's now become a little bit more loose in the restrictions, and people are pretty much doing what they were doing pre-COVID. And of course, that's a good thing. It's great for the economy. It's great for people. It's great for the psychology of everyone. But again, we want to caution and make sure that we don't do too much too quickly. And especially because there's that Delta variant that's out there, and people are getting breakthrough infections, meaning that a lot of people that are vaccinated are getting some COVID infections as well. Nowadays, we're hearing it's about 20% here in the U.S., right? 20 to 30%. They're saying the numbers will come in soon, and then we'll get that per month. But it's important again to emphasize that although we see these things and we see these warnings, over 50% of the U.S. population has been vaccinated now, and now there's a push for children to get the vaccine 12 and above, especially because there's another month and a half and school will start in the fall, and everyone's looking forward to live school and going back and getting back with the teachers and on a mass scale. There was a lot of private schools going functional, and they were very careful and they did a very great job. But now on a mass scale, a lot of the school districts and the counties are opening. So it's important that we know what we're doing in terms of getting our children vaccinated. And lately, there's a lot of media and there's press about the myocarditis with the Pfizer vaccine. And I just wanted to kind of shed a little bit of light on that and see what the Pfizer vaccine has done in terms of the risk of myocarditis. Myocarditis, of course, is just a little bit of an inflammation of the heart muscle. And what they do is they treat it with some antivirals and rest and monitoring, and most of these cases have resolved. And it's nothing to prevent you from getting your children 12 and above vaccinated before they get back to school, especially now that we see that there is this Delta variant that's out there. And if we look at the numbers in terms of vaccinations and states that have been vaccinated versus those who are lagging behind, we see that the infection rate of COVID itself nowadays in states which are lagging behind in vaccination is 3 times as much. So, for example, Mississippi, Alabama, Arkansas, Wyoming, I think Louisiana, these are the top 5 states that are at the lowest tier in terms of getting vaccinations, and they are at the highest tier of getting new COVID infections, and a lot of them are from the Delta variant. So that's why masking is encouraged in public spaces and spaces where you don't know who's who and whether they've had the vaccine or not. Masking is highly encouraged, and I foresee that. I think they might bring back the mask requirements in public spaces again. So that's something to keep yourself and keep your kids in check and safe, is to mask when you are in big crowds and outdoors and places where you don't know what people's vaccination state are. That's very important to keep in mind. Getting back to these breakthrough infections, breakthrough infections are infections where people are, have gotten their vaccination regimen and yet they're still getting infected by this Delta variant now. And the latest research just came out from Israel on the Delta variant that the vaccine is about 65% effective, as opposed to 92 or 93% with the regular strains of COVID. But with the Delta variant, it's about 65% effective. Meaning what? Meaning that the vaccine, what does it do? What's the purpose of getting the vaccine? The purpose of getting the vaccine is to prevent death and to prevent severe disease. And to that end, the vaccines have been very successful, very successful. As you look across the world and you see what's going on in countries like, India, Afghanistan, Pakistan, southern, Brazil, here, South America, even Mexico, places where they don't have enough access to the vaccine, infection rates are high, the variant is high, and people are still, passing away from COVID. Here in the U.S., if we look at the data from the month of May, just this May, I think there was about 18,000 deaths from COVID in the month of May across the U.S. Approximately 18,000 deaths, and 150 of those deaths were from vaccinated people. So people that were actually vaccinated and they still got COVID and they still passed away because of other comorbidities that they might have had, other conditions, So what we see there is that from that 18,000, 150 of them were from the vaccinated population. The other 17,850 were from unvaccinated people. So as you can see, it's a figure like 99.2% of the fatalities from COVID in the month of May in the U.S., which is a largely vaccinated nation now. It's more than 50%. 99.2% of all fatalities from COVID in the month of May were unvaccinated people. So, we have the vaccine that's available to us. We have it here. I encourage you, especially if you're between 18 and 65 years of age, go get the vaccine. It's something which will make your life easier as we transition into these other variants of COVID coming on. It'll make God forbid you get COVID, you'll have a very mild experience with it if you have the vaccine. That's what the numbers are telling us. So the vaccination is working. The numbers are low among vaccinated people. Fatalities are low. Severe disease is low, and there are breakthrough infections that we see. There are clusters that we'll see in the U.S. as well, maybe in healthcare facilities and things like that. There was an outbreak in Indonesia as well, but Indonesia, they're using the Sinovac, which is a Chinese vaccine. So some of these Chinese vaccines have shown that they're not producing antibodies. So there's some issues with that. But in general, if you have gotten the vaccine or if you're going to get it, you will be in a safer state than those who don't get the vaccine. And some of you might say, oh, but we have natural immunity. We got COVID, over 4 months or 6 months or 8 months or 9 months ago. Still, it does not. It will not help you with the variants. It's important to go and get at least if you've had COVID, at least you should get one shot of either Pfizer or Moderna to make sure that you have that high antibody titer. It's very important. It's very important, and you're doing yourself the favor, and of course you're being considerate of society, because this is it's a responsibility which is put on the society in general. This is not individual rights or individual mandates now. It's about doing what's best for people living around you and for yourself. It's not just you, it's your family, your community, your city, your county, your state. So please, again, we have availability, we have access at your local pharmacy to these vaccines. And if you're hypersensitive or things like that, talk to your primary care physician. They'll give you mechanisms and ways to get the vaccine so that you don't harm yourself, and that so that you're protected. Talk to your personal physician, get their advice, and get yourself vaccinated. Going back to myocarditis among children, so among females, I'm going to discuss predicted cases, prevented versus myocarditis for every million vaccinated dose of vaccines over a 120-day period. So this is something where the vaccines for females between 12 and 17, this is the age where there was a concern about myocarditis, inflammation of the heart, right? So there was 8,500 COVID cases prevented. Okay, and this is for a million people that got the vaccine between 12 and 17. There was about 183 hospitalizations prevented, 38 ICU admissions prevented, and a couple deaths that were prevented. And between all that, there was 8 to 10 myocarditis cases. So if you look at the numbers, it's very minimal. It's very minimal. And, that was in females. In males, the myocarditis between the age of 12 and 17 was higher in boys that got it. But it was only about, among that million cases, it was probably 50 to about 60 cases of myocarditis. And that data is coming from hospitalizations and ICU admissions, and that was based on the week of May 22nd, 2021. So if you look at it, it's not what we would say negligible or significant in terms of the math. So again, the prevention of cases and the overall benefit is better than the risk. It's much more better than the risk. So that's something where you got to keep in mind. Again, the myocarditis occurred more in males, and the predilection was for males. And I think that even then, it's still prevented more, many-fold more COVID cases than the myocarditis that occurred. So, barring any other issues that your child might have, if they have any kind of, compounding issues and other maybe autoimmune diseases or other types of allergies, then you should discuss it with their pediatrician. But overall, especially since schools are opening up and people are going, and we do have the variant that is taking a good amount of real estate in terms of infections now, we have to be careful with that. And if we're going to have our children in an open environment in schools and going back for day-to-day education, then it's important for them to be vaccinated. I have children myself. All of them have vaccinated except the ones that are under 12, and they've been fine. So personally, we've done this with our own family, and we find there's nothing wrong with it, and it's protective for it, and it gives us as parents the peace of mind where if they're out and about and God forbid they catch someone that has the COVID, or they get the infection, we know that it won't cause the fatality, and it won't cause severe disease. At least there's a 60% plus chance of that it won't. So the odds are in your favor. So you got to play the numbers and discuss it with your personal and primary care physicians or your pediatricians when it comes to your children. But in terms of the myocarditis, it's not a significant risk. And so that's important to keep in mind. And of course, you want to make sure that, you keep yourself healthy and hydrated, and you eat good and well foods, as we discuss all the time on this program. What you eat is very important in what you, in terms of your nutrition and your vitamin levels, and just trying to increase your own immunity. That's very important. That's very important, especially in these times where we have these things running around. And then, of course, lifestyle and public choices you make, where to go, where not to go, and whether it's necessary to go somewhere. It's important to keep that all in mind, especially now because we're at the cusp of really, putting COVID behind us. But there is this variant, and if we're a little bit more careful and a little bit more conscious and aware of what's going on, and we hang in there for a little bit more, you know, we can overcome this whole scenario in a very successful way, as opposed to what we see going around the world. Because we're fortunate that we have the vaccines here, we have enough. But there are countries where, you just look at Canada, our neighbors, to the north, Canada, and to the south, Mexico. We see that because of lack of vaccines, their infection rates are much higher. And, Canada is just sufficing with one dose. They're saying at least get one dose so that their numbers improve. And now they're getting it. So we're fortunate here in the US that we do have access to these vaccines. We should make it a priority to get what we can, and it's available to us. Um, uh, so I encourage you and your families to go ahead and get it. And then with these surveys that are going around, 6 months ago, 40% of the population wanted to get the vaccine as soon as possible. Now that we have 50% plus that have gotten it, there's only 2 to 3% that are saying that, we want to get the vaccine. And there's about 70+% that are saying that, oh, we don't trust the government, or it's too early, or they believe these conspiracy theories about the vaccine. I'm someone that got the vaccine early on. Myself, my wife, our colleagues, everyone has got them. We haven't seen any negative effects. What we've seen is positive and positive results from the vaccines. We've seen ourselves being able to travel now, and we can, be comfortable amongst others that are vaccinated, and things are getting back to normal in terms of life. So it's important to keep those things in mind, to encourage others, and talk to your doctors, talk to your physicians. If you have any allergy related issues, there's ways that you can still get the vaccine and not provoke those allergies. So it's important. I wanted to share that with you today, and because it's in the news. The research from Israel, I think, just came out this morning, that even for the Delta variant, it's about 65% effective in preventing deaths and severe disease. So that's very important. That's good. That's good news. And eventually there might be boosters that need to be taken. But all in all, I think it's a good thing. Vaccination is working. It's preventing deaths. Look at the numbers here in the U.S. Look at the numbers at any country that has high vaccination rates. You will see that the number of infections have dropped. Any states here in the U.S. that you look at, apart from Alabama and Arkansas and Mississippi and Louisiana and Wyoming, which are the five lowest vaccination rates, all the other states that have been doing vaccination have reported a decrease in COVID infections. So it's very important to keep that in mind, and get yourself and your family vaccinated. And if there's any concerns, talk to your doctor. And please be aware and cognizant of where you go, what you do, so that you don't put yourself at extra risk, especially your children that may not be vaccinated. We don't want them to, contract this virus and spread it to others. So we are on the phase of dropped cases and containment. So that's great news. But if we want this to maintain this way, and we want to, get back to complete normality of life, it's important to use what we have at our disposal in terms of vaccines. Again, if you have any questions or concerns, please comment and please write so we can respond to you. And other than that, thank you for joining us this week. And we'll see you next week with another health topic. You guys stay safe and cognizant and aware of everything that's going on around you. And get yourself vaccinated and your families. Thank you and have a great day.